Statewide program started here in the metro is seeking to tackle mental health struggles in children as well as offer more mental health support in rural communities. Our Marla Lundak shows us how.
Michael Havacost has been a doctor for decades. At his primary care practice in downtown Beatrice, he sees a little bit of everything, including mental health struggles.
Pediatric cases of depression and anxiety have really increased since the pandemic.
In rural communities like his, there aren't many, if any, mental health care providers.
A lot of our primary care colleagues are in the trenches, they're on the front lines taking care of these kids, but have had limited training in mental health care.
Dr. Jennifer McWilliams is the division chief for psychiatry at Omaha's Children's Hospital. She's also the medical director of the new COPE program. It's a program that offers an intense 3-day training course for primary care doctors across the state. It gives them the knowledge and skills they need to take care of kids with mild to moderate mental health concerns.
A lot of kids don't need medicine. They need therapy, they need mentors, they need different resources that are going to be in their local communities.
Dr. Havacost was one of the first providers in the state to participate in the new program. And before now, if a child came into his office with a mental health care need, he likely would have referred them to someone else due to lack of time and resources, but not anymore.
This allowed us the opportunity to be able to evaluate kids for mental health problems and then take a step and start treating them in the process and have backup with somebody else that we can call and say, this is what I've got. How can you help me differently to improve this patient's care?
The new program, which partners with the REACH Institute, offers providers a consultation and resource identification program, places they can go to ask questions and get recommendations about the best course of action for kids with mental health issues.
This isn't, trying to train, your pediatrician to become a psychiatrist. It's the core, common things that affect kids. So ADHD, depression, anxiety, aggression, and behavior issues.
Dr. Havacost says the training makes a major difference, and it's a big step towards combating mental health struggles before they intensify, especially in rural areas.
Probably 2 or 3 a month we see that we could say, I wonder what's going on here. And now we have the tools to start that evaluation process.
On your site in Beatrice, Marla Lundak, 6 News.
Children's Hospital says they're already in the planning process for the next training session, which will take place this October. A